The beat continues. The beat towards ending malaria. The beat towards strengthening health systems. The beat towards protecting the gains in global health. During COVID-19, we at Wacky Health, we've been wowed by Youth Leaders for Health. 25 young people from across Africa, specifically Tanzania, Ghana, Sierra Leone, have come together and through the Beat Continuous platform have demonstrated in their ingenuity in terms of finding a solution during this time of COVID. On the Beat Continuous platform, these young people have been advocating for continued support towards ending malaria, for continued youth engagement in decision-making and policy processes. And that is why, on behalf of Wacky Health, I want to celebrate Youth Leaders for Health. I want to celebrate young people all over the world who've been catalysts of change, who've been utilizing their voice, who've been challenging the status quo. The Africa we want is an Africa where young people are included, young people are respected, young people are prioritized. This is the Africa that we want. This is the Africa that young people have said they want. Happy Africa Youth Month.
Hello everyone. In January this year, 25 young people from 3 countries, Ghana, Tanzania and Sierra Leone, came as youth leaders for health and a 5-day immersive training, and there's a lot of buzz and people had many creative ways of engaging with an advocacy training. They went back home and what did they find? Suddenly they faced their world turn upside down because of COVID, and they felt really paralyzed. How would they go and meet people? What will they do? At that time, Wacky Health, a Pan-African organization with its leadership, Rosemary, and the team came up with this great idea of setting up a platform in the YouTube. They call it The Beat Continues, in which anybody could actually beat and then give a message for getting a stronger health system in all these countries across Africa, but also talk about malaria, which actually kills a child every 2 minutes. And that released, it seemed, people to start drumming up all kinds of people, grandmothers, granddaughters, rappers, magistrates, women, men, and across Africa. And indeed, some great artists across the world also joined. Some of the best drummers from across the Commonwealth also joined this. And indeed, they made music called Win This Way. But now, after that, the initial taste of that power led them to do other things to build on this movement of youth leaders bringing about change. They were engaging again with the Commonwealth, with the virtual health ministers meeting, and they were able to communicate their message in the Commonwealth communique. And they kept thinking through how do we systematically build this inner capacity and ambition of young people. And then now they got another fantastic opportunity. November comes November, we have African Union celebrating youth. And on 27th, there's going to be some magic happen. There's a new song as well. Watch this space. Wacky Health has really facilitated huge action, activities and energy for youth leaders. Go for it. Go for them.
Hi everyone, my name is Amanda and I lead youth engagement in the Youth Division of the African Union Commission. The Africa Youth Month 2020 theme is very important to me and I think quite timely because across the continent we can see young people raising their voices and taking action and beginning to engage each other and their communities for tangible change. And this is precisely what we are trying to amplify and support with the theme of this year. This is what the theme is about. And I cannot wait to see what we do in the month of November and beyond.
Hello, my names are Alois Polorasa. I'm a youth leader for health. I'm also a Rotaractor. That means I'm a member of Rotaract Club of KCMC, where I also serve as a vice president. I'm also a malaria champion. I live in Tanzania. I was born in Tanzania. I love advocating for health system strengthening and also advocating for better health for all, that is universal health coverage. I'm advocating for this because One is that I am directly engaged in health as a laboratory sciences student, but also I am passionate about seeing a health community because I believe in health generation, that's where we can generate even better economic status for our communities. With poor health, it's obvious that people are going to live in poverty. I therefore advocate to ensure that there is political will to end poverty through strengthening health systems. I also advocate to ensure that all people in all places, rural and urban places, have access to proper and sufficient health care. I'm celebrating this African Youth Month where I'm celebrating or cheering for youth leaders for health. These are 25 youth leaders who are well trained in advocacy, 10 from Tanzania, 10 from Ghana, and 5 from Sierra Leone. I'm also celebrating the African Union Youth Envoy Office, which is really struggling to ensure that young people are fully and meaningfully engaged in health system strengthening. I'm celebrating the Malaria Champions and the Malaria No More UK, but struggling everywhere to be good ambassadors to ensure zero malaria. I'm celebrating the Rotaractors all over the world and the Rotarians who have been ensuring that we live in a health and well-developed community. I'm celebrating every person, every young person who is taking his efforts to ensure that the world is a healthy world, who is ensuring that their community is a healthy community, who is ensuring that everyone who is around them has access to better health services. COVID-19 has brought a lot of harm to healthcare provision and to malaria prevention as well. It has brought a lot of ambiguities in fighting malaria. There have been a lot of similarities in the diagnostic features of COVID-19 and malaria, hence affecting the way healthcare workers are providing services. But COVID-19 has brought people back home, people who are working in the communities, who are working with the communities, around the communities. They have remained home due to lockdown because of one of the effects of COVID-19. Therefore, we have missed a lot of people at the ground to fight malaria because of COVID-19. I'm calling upon the governments to ensure that they increase resources to fight malaria. They increase resources to ensure that COVID-19 is completely ended. Increase resources to ensure that young people are more engaged in fighting malaria. Increase resources to ensure that the community health workers are well resourced to fight malaria. I believe that we can end malaria, and this is the generation that can end malaria. Cheers to African youth. Cheers to all African youth supporters. Cheers to all leaders who are committed to ensure health communities. Cheers to everyone who loves to see young people engaging. Zero malaria starts with me. Zero malaria starts with you.
My name is Priscilla Aidoo, a youth leader for health, interning with Hope for Future Generations and serving as the national president for the Young Health Advocates Ghana. I advocate for the inclusion of young people living with HIV on the decision-making table, as well as the increase in domestic funding for malaria in Ghana.
My name is Monish Yamaka. I'm a youth from Zimbabwe and I advocate for sexual reproductive health and rights. This entails promoting awareness on issues to do with gender-based violence, access to contraception, abortion, HIV and STIs, maternal health management, and menstrual health management. I discovered my passion for health in 2012 when I joined the Youth Against AIDS Club in my second year of high school. Through the club, we got to visit people who were infected with HIV and AIDS and living with the virus. It was through these visits that I realized that there was a need for someone to stand and promote awareness on the issues of HIV and AIDS so as to decrease the number of HIV-infected and affected young people. It was then that I embarked on PA education training in high schools and as well as tertiary schools now. So I get to link young people with the relevant service providers as well as to advocate on SRHR policies that actually support and include more on HIV prevention and research. This Africa Youth Month, I would like to celebrate the AFNI Youth Cohort members. I celebrate them because they are a group of young people from different African countries who have managed to unite despite their differences, despite their different cultures, their different religion, and different beliefs, to keep an eye on HIV prevention even amidst the COVID-19 pandemic. So with a drive like theirs, I feel that an Africa free of HIV new infections is still possible.
My name is Farhan Yusuf and I am from Tanzania. I am a pharmacist by profession and I have been working in the area of pharmaceutical supply chains for quite a few years now, And this year, I've been serving as a youth leader for health, a program that is providing capacity to young African leaders from 3 different countries, and giving them the necessary skills to advocate for health system strengthening and to particularly fight against some diseases such as malaria, neglected tropical diseases, and now the COVID-19 pandemic. I have always been extremely passionate about health, which is why I picked pharmacy as a career. And I think the reason why is because, as we have seen in light of the current pandemic, health really is a very important aspect and it covers basically everything in our lives. And without health, we really can't do much. As far as COVID 19 is concerned, I personally also have a particular focus on mental health. COVID 19 has had mental health effects on the people who are suffering, on the healthcare workers, and on the families, and pretty much on everyone else because of the lockdowns, the economic consequences, and so many other challenges that we have faced because of COVID 19. So I really think, as a mental health advocate, that we need to really push for increase of mental health services, mental health support, mental health counseling in all our countries, especially for the young people. That would be one of my messages for the Africa Youth Month. Another thing that I would like to talk about is, why should we be celebrating Africa Youth Month? I mean, Africa is the continent with the youngest population in the world, which means that the responsibility of development lies very strongly on the shoulders of the young people. So together we must support each other, we must work together, we must forge partnerships, we must help each other make this continent reach where it is meant to, and we can only do that as a collective and not as individuals. I think in terms of changes that can be done both specifically to mental health but also generally for youth, is that we need more implementation rather of policies. We need more support to young people. We have the African Youth Charter, which is a document of the African Union, and I think more of our countries need to ratify that document and also ensure that implementation of different programs, different objectives related to young people in the African countries keeps on happening. Moving forward, what I urge our different leaders to do is to prioritize young people, include them in the decision making process, and take care of their health and especially their mental health, which is primary to their functioning within the society and to be able to contribute economically, socially, and just be the responsible citizens of Africa that they need to be. To my young people out there, please, please, please get involved, find your voice, become advocates, and just work together. We have a lot of work to do in Africa, and there's no one else to do it aside from us. So once again, happy Africa Youth Month to everyone out there. Be safe, take care of yourself and of each other, and let's continue engaging.
My name is Ayanna Kamara. I'm from Sierra Leone, a youth leader for health. I'm a social worker and I've worked with few youth-led organizations in my county. I'm presently serving as a youth leader for health, advocating at different government meetings where we have representatives from different government agencies, ministries, and organizations working on malaria to advocate for the increased funding for malaria. I'm passionate about health because I've learned how much it really matters and how the lack of good health systems can lead to the loss of many lives in the county, in the nation. I'm celebrating ourselves, we the youth of Africa, because I believe that we have all what it takes to shape the future of this continent when given the right opportunities and platform. I'm passionate about health because I know I've learned how much it truly matters, and how the lack of good health systems can lead to loss of lives. They are what really inspired me to join the fight against malaria. There was an incident that happened in my family some years ago where we lost my younger cousin, who was only 4 years, to malaria as a result of the little idea we had about malaria back then and the little malaria services that were available back then. So that incident really inspired me, and the thought of it to make sure that no child ever dies of malaria kept me going. What could be done better in my community is the distribution and monitoring of mosquito bed nets to ensure that this mosquito bed net reaches the right people, for example, lactating mothers, the pregnant women, the children, because they are the most vulnerable people to get this disease. And there should also be laws for lawbreakers, because in my country, in most communities, these bed nets are not used for the intended purpose. Some communities use bed nets as fishing nets. As we celebrate the African Youth Month, we, the youth of Africa, are asking for more opportunities, because I believe that youth, when given the right opportunities and platform, can be an effective drivers of change. We want to be partners in making policies, especially policies that involve us and our communities.
Hello. My name is Nondobego Shabalala, and I'm the communications lead in the youth division at the African Union Commission. The Africa Youth Month theme is important to me because every pivotal moment in history started as the idea of a young person. And you see, once that idea is articulated well enough, it inevitably spurs the people around them into action. And once that is done, it enhances engagement, it enriches engagement. And for me, the idea that young people can build a better Africa resonates so strongly, because I don't think anything is truer than that. Happy Africa Youth Day.
My name is Nik from Kenya. I am a private school teacher in Embu. I am also an active member of Stop TB Champions of Kenya. I became a TB champion after defeating the disease twice. However, the second time hit hardest as I lost my left lung and I operate on my right lung. It is from my experience that I decided to join hands with fellow champions and fight TB and tell people about TB. This Africa Youth Month, I celebrate my fellow TB champions for the good work they are doing out there. They have achieved quite a lot in educating people fearlessly about TB and lung diseases like COVID-19. COVID-19 has greatly affected my work as a private school teacher, as I am currently on unpaid leave. I have also lost time meant for learning with my kids. This is due to closure of schools since March for quarantine. However, the greatest challenge for me as a person during this COVID-19 period has been that if I happen to get COVID-19, my survival chances would be very minimal. This is because, as I said earlier, I operate on one lung, and that means I am weaker than everyone else. I really wish we had better support from the government as TB patients and champions.
I am Elizabeth Njeri Kihuha, a Kenyan citizen, a board member for Rare Disorders Kenya, and I represent people with rare diseases. Rare Disorders Kenya is an umbrella body, and some of the diseases it represents include Gaucher, Joubert syndrome, narcolepsy, ring 18 chromosome, hemihyperplasia, hereditary angioedema, myasthenia gravis, and spinal muscular atrophy. Some of the challenges experienced are like there's lack of information and support, there's a limited or no treatment option, there's delayed treatment, and misdiagnosis. I am inspired by how much strength and hope a person living with a rare disease has, and how willing they are to share their everyday struggles, the milestones achieved, and their positive outlook towards life. What keeps me in this fight is the fact that I have so many people around me who've given me unconditional love and support, and they still continue to do so. And by support, I mean financial support, emotional support, spiritual support, and physical support. There are times I I cannot even walk on my own, so I may need someone to walk with me. So this kind of support and love I cannot repay. So my only hope is that I can be able to pay it forward. What fuels my passion about health and advocating for it is the fact that I have a rare disease called myasthenia gravis, and it affects the voluntary muscles, which causes weakness. So if any or all the voluntary muscles are affected, I have problems speaking, I have problem walking, I have problems waking up from a seated position. I don't have control of my facial expressions, and I'm talking about like 650 voluntary muscles in the body. They're spread all over the body. This month, I'm celebrating children with rare diseases. They are fighting to remain sane in a world that has been turned upside down due to COVID-19. How COVID-19 has affected our members is by one, some of our members are taking immunosuppressants, and this leaves them vulnerable to attack. You cannot control when a medical emergency or a crisis arises, and we hope and pray that when it does not happen during the lockdown hours. The third reason is the social well-being has been affected, because at the moment we're practicing social distancing. Hugs and handshakes are not allowed, so for safety reasons. So it is affecting the social well-being of our members. Getting a diagnosis for a rare disease can feel like the longest detective investigation. It's very frustrating, and it can take years. What we need is support for Rare Disorders Kenya as we work on patient advocacy. We also need psychological counseling for the patients and their caregivers. Having a rare disease is a burden, and it does not affect only the patient but their loved ones. So having a rare disease can take a toll on you emotionally and financially, causing stress and depression. Some of our members also need specialized machines and equipment to survive and to improve their quality of life. This Africa Youth Month, I'd like to ask the employers and the clients working with someone with a rare disease to stop the stigma and the discrimination. We have to make adjustments to ensure that we thrive in our work environment. A little kindness goes a long way.
Hello, my name is Aisha Farah. I'm the campaigns officer for Send My Friend to School, an organisation that helps to ensure that young people all over the world receive quality education. I've been following the brilliant work done by the African Youth Leaders for Health, who have led with courage and dedication in an extremely difficult time. COVID-19 has turned many of our worlds upside down and has become one of our biggest challenges when looking at global progress. Youth leadership is needed now more than ever, as young girls, young refugees, displaced people living with disabilities, future in education, in health and in prosperity hangs in the balance. We need your voices, your leadership and your vision to ensure that nobody is left behind. I feel that the words of Malala Yousafzai puts it best when she says, the important thing is to always ask the world to do some things, but sometimes they cannot be done. So you have to take a stab and you have to do them. I have every hope that you will. The best of luck.
My name is Lillian Simiyu. I come from Nairobi, Kenya. I work at Awoche Foundation, which is a Agape Woman and Child Empowerment Foundation. In the foundation, I work as a peer counselor and mentor, and I work with young people. I'm very passionate about mental health. And the reason why I'm passionate about this is because personally I've suffered from a mental health issue. And what inspires me to do what I do is I have interacted with a lot of young people who are going through the same thing. So I would like to see a situation where young people are better placed to deal with their mental health issues, that are better placed to seek help when they need to, and they can actually access that kind of help when they seek it. It's Africa Youth Month, and during this month, I would like to celebrate all my people in Awoche Foundation, because I think they're doing an amazing job in trying to better the life of the girls that they work with through mentorship, through opportunities to exercise their skill and talent. And yeah, I would like to appreciate everyone I work with at Awoche Foundation. During this pandemic, the mental health of very many young people has been affected. Why? Because most of the young people have lost their jobs. Most of the young people have had to deal with issues like anxiety and depression because of the effects of COVID-19. So there has been a lot of issues around this area, and in the areas of mentorship, for example, many students or pupils access mentorships in schools, and schools have been closed. So there has not been a lot of avenues for young people to get people to mentor them because there are no schools, there's no churches. So we've had a lot of issues coming from young people, like crime, like teenage pregnancies. So this is just how, in a nutshell, how COVID-19 has affected the areas of mentorship and mental health. Well, what can be done about this is, one, we need to have our legislators come up with better policies for our mental health to ensure that mental health services are accessible in this country, everywhere in this country, not just a few places, because currently we have very few hospitals that offer this kind of services. We also need our government to give more funding to the mental health sectors. We do not have enough human resource. We do not have enough psychologists, therapists, psychiatrists. They are not enough. So we need to have these people on board so that it can be easier for people to access mental health services whenever they need them. And for mentorship, we need the government to come with a way of accessing and still mentoring the students, especially those who are not back to school yet. And also we need this, it's important for also the organizations, NGOs and CBOs to see how they can mentor these young people so that even as they stay at home, they find productive ways of using their time. I think for us as a community, or even just usual citizens, I think for our part to play in the mental health issue is to end stigma. There's a lot of stigma in regards to mental health issues, and especially for men. It's natural, it's expected that men don't talk about their problems, they don't show emotion, they don't show weakness. But it's true. It's also true that there's a lot of high rates of suicide come from these men that we are talking about in this situation. So the problem is there and we can see it, the evidence is there. So let's provide enabling environment for people to be vulnerable, for people to talk about their problems, and for people to be empowered to seek help when they need to. Thank you. The beat continues.
Greetings everyone, I am Obuche Ike Deborah, the Executive Director of DHGC Nigeria. Debridge Health Development Center is a registered civil society organization that is deeply involved in changing poor health outcomes in all primary healthcare areas. It gives me great pleasure and excitement to be part of this remarkable event today, because I think this is an opportunity for us to interact and brainstorm on how we can do things differently in order to change the narrative. Permit me to cast our minds back to the beginning of the COVID-19 pandemic. You remember that it was predicted that Africa is one of the continents that will be hit hardest with the COVID-19 pandemic. This is due to the fact that our health systems are weak and also the high disease burden, for example, HIV and TB. I like to also remind us as Africans that Africa is a unique race, richly endowed with knowledge, creativity, beauty, strength, and numbers. Evidently, Africa has been benefiting from several global initiatives that are targeted towards improving our healthcare systems and reducing the disease burden. But the question is, for how long will we continue to depend on donors to improve our healthcare system? For how long will we continue to depend on donors for such an important determinant of our lives like health? On this day, I'd like to call on our leaders, our governments, to mobilize domestic resources to fight diseases like tuberculosis and HIV. On this day, I like to urge African youth to come together, to arise and leverage on the power of our numbers, to use our voices, our knowledge, the internet to change the narrative. It is time for us to hold our government accountable to provide us with the kind of health systems that we deserve. It is time for us to use our voices through the social media platforms to create awareness on services that can be accessed and utilized at the primary healthcare level. It is time for us as African youths to use the social media platforms to prevent avoidable deaths like maternal mortality, vaccines preventable mortality, HIV and TB related deaths, and also deaths from common illnesses. It is time for us to take action. African youth, it is time for us to spend our time and resources on research, development, innovation, the creation of simple applications and softwares that can be used to monitor and to manage simple illnesses. It is time for us to stop all these deaths that can be preventable. African youth, it is time. It is now or never that we can use our voices for the betterment of our lives. Thank you.
Hi guys, my name is Maiza from Kenya, and I'm the National Coordinator for Y Plus Kenya, which is a youth-led consortium of organizations working in the HIV response. I am passionate about health because it is a cross-cutting factor among all ages, but more importantly is that you can actually see the tangible impact we make for young people that we work with. So this month I am celebrating Jerop Limo because of her wonderful work in social media advocacy specifically, which has been very fruitful, especially during this COVID period. During this time, my work has been affected because it took a lot of time for young people to adjust to online systems, which were quite hard, and considering that all our in-country processes were moved virtually, it made it even more difficult for young people, especially in the rural areas, to connect with us. In our communities, I think what could be done better in this response is the actual implementation of all the frameworks that have been developed for adolescents and young people. We have 1 billion frameworks in Kenya that talk about young people, but the actual implementation is not taking place. Going forward, I think what is important for me specifically is that as young people, we want comprehensive sexuality education for us, and this will enable us to make informed decisions about our health.
Hello everyone, my name is George Jeremiah. I'm currently a final year medical student, and I would like to take this opportunity to thank the various stakeholders for recognizing this month as African Youth Month. Indeed, personally as a medical student, the pandemic has really highlighted, though unprecedented times as it may, it has really highlighted us, especially for us as youth, the various opportunities, and if we have resilience, we can survive any situation, no matter how dire it is. And I'll just love to encourage all the youth from all over parts of the world that we ought to see in every challenge, we ought to pick opportunities, and with resilience we'll overcome. Thank you.
Big up all the youths that are working harder. Some of them are employed, some of them young bosses. Look at us say that your dreams are valid, yeah. Better pick up yourself every time you're falling. Like a flower, depends on pollen, yeah. You're the leaders of today and the world is watching, yeah, yeah. Young teachers, preachers, innovators, leaders. Whether you're a nurse or a presenter, never let anybody silence, yeah.
So we continue,
and we walk one step for more.
It's about me and you, youth of society. The beat continue,
and we walk one step for more.
It's about me and you, let's build a society.
Yeah. Boy, I need a minute, I'm sorry, having a moment, I'm happy hollering, coloring, this is victory major. The youngest industry, fashion, I'm African army, and topping off from Kenya, the son of a dream, packing, I mean. Isn't it beautiful having the people moving the mission? I'm doing musicals, trying to make up a better rendition of what if nobody made it from down, bottom to glory in.
Dine fine, I'm fine buying from prime rhyme. The mood aggressive and young people are coming at it, full of innovative and heavy blowing ideas. Whether food or in a trade or making money from a gift, I wanna pick up everybody who be trying, keep it coming and going. See young baby girl making electricity to spark a dream of being a doctor one day, from spare parts and campsites, just to put some hours up and study.
What time is it? This is Africa Youth Month. We come together, you know that's a union, fighting for better days. But for now, the beat continues,
and we walk one step for more.
It's about me and you, youth of society. The beat continues,
and we walk one step for more.
It's about me and you. Let's build a society.
Yo. Funny how American dream had me in overly passion before. Seeing the grapes in arenas having a roast, for believing I was in awe, for the reason of having to wonder how can I be enough, or even have an avenue. But over time I'm happily proud we doing it. As baby Africa shaking and breaking beliefs, trends in technology, look how M-Pesa happening. We taking them shoes and making it fit to international. We maverick, king and export, family growing the best crops properly. Who like African, the best from young people, the future big thinkers and dream life changes. Office to off course, catch up to outdoor. We be making a noise and passing up encore. Hearts beating in rhythm to nothing can stop us. How? The beat continues, bro. Raw.
What time is it? This is Africa Youth Month. We come together, you know that's a union, fighting for better